We're on the cloud. All right. So welcome everyone to the Tricare You webinar. We are so happy to have you with us. The Tricare You webinar is sponsored by Armed Forces Insurance. They're amazing, and they have donated two $25 gift cards. So those of you that are on with us live, we will be doing a drawing at the end after the Q&A. Please hold, you can always type in your questions. I will be scanning them, and at the end, we will get to them. But I'm going to turn it over to Shantae. She is amazing. She is with Humana, and she is the Managed Support Care Liaison. Did I get that right?
Managed care support. Yes,
yeah,
ma'am.
I pretty much got it. All right. Yay, go me. All right. So it's all you, girlfriend. So you just let me know what you need.
Thank you so much, Sarah. And good evening, everyone. Thank you so much for having Humana Military a part of your event today. I am going to brief you guys on your Tricare benefits. This is a very simple overview of the program and what types of options are available to you guys as family members and spouses, and what's also available for your active duty service members as they transition through their military career. So this again is very broad information. You can definitely feel free to ask questions, and I will handle as many of them as I possibly can. All right, Sarah, do you mind advancing for me, please?
Oh, let me, why is this? There we go.
And another, please.
Okay, there we go.
Okay, so thank you so much, Sarah. Tricare basically is a government entitlement. It's provided to you for your family members' government service. We have two different networks. One that you will definitely become familiar with if you are primed to a military base, and that would be the service that you get through our military hospitals and clinics. And then there is the other portion, which is the civilian network, which includes care here statewide and also overseas. Here statewide, if you are on the eastern region, your care would be administered through a Humana military network provider. And if you're over on the western region, which you'll see in the next slide, you would receive your network care through Health Net Federal Service providers. Next slide, please, Sarah.
Okay, there you go.
And Tricare used to be divided into 3 regions. Your benefits are literally the same actually from region to region, but as of January 1, 2018, they did away with the 3 regions. So now there's no north and south, it's just an east and a west. So again, Humana Military manages the eastern region, and Health Net Federal Services manages the western portion. And just to let you know, Congress actually decides on what benefits and boundaries the Tricare program provides. It doesn't matter who the individual contractor is at the time, because contracts, just like any other government services, they are bidded on and awarded to different companies at different points in time, but your benefits will not change. Tricare is a program in and of itself that does not change unless those changes come through Congress. So just bear that in mind when you think about the different administrators. Don't think that your benefits on the East would be any different than those in the West and vice versa. Sarah, could you please advance?
Mm-hmm.
This is something that I like to tell everyone, no matter what type of briefing I'm doing. I like to tell people to please make sure that their DEERS information is up to date. The information that is stored in DEERS is critical. It is very important that you keep your ID cards. That is how you get your care when you are accessing those civilian networks. That is your technical insurance card. A lot of spouses ask me, well, will I get a traditional insurance card? You do not for the Tricare program. Your identification card is actually how you will receive your care. So for example, if you are utilizing civilian services for maybe a network emergency room, it's important that you have your card with you at all times, and that is what you will present at the time of service. So this slide shows the different ways that you can update your information in DEERS. Now, the sponsor is the only person that is able to actually add a dependent into DEERS. However, any adult over the age of 18 is able to update their own information in the DEERS system. So if you have college children who are maybe 18 or 19 years old and they're off in school, they can certainly call and provide their updated college address in case anyone needs to do that. And I see a question popped up.
Yep. So getting the question about whether or not ID cards can be photocopied for insurance purposes.
Oh, that is a good
That
question.
is, yeah.
You know what? Because I actually worked at a base, technically, we weren't supposed to take photocopies. They do want to see the hard copy of the ID, but I think for civilian network purposes, they would probably be okay with having a copy of it. It doesn't hurt to just double check. And if you can keep a copy, your hard copy on your person at all times, then I would definitely say make sure you keep it. I know at the base that's something that they don't really want to see you doing. But in the civilian world, I'm sorry, I can't really tell you necessarily if a civilian provider would turn you away with just a photocopy of your ID. I think the best thing to do is just to have the hard physical thing.
Mm-hmm.
Okay. But going back to keeping your info up to date in DEERS, this information is also used for tax verification purposes by the IRS. And that's something that you're going to see at the end of the presentation that's addressed as well. So again, DEERS is very, very important in keeping all of your info squared away. Like, it's no one's responsibility, honestly, to keep that information accurate for you. So you guys, especially as family members, have to support the service members and make sure that that information is kept current. The next slide, please, Sarah. Thank you. And again.
Mm-hmm.
So this is just a quick snapshot of all of the programs that are available under TRICARE. Again, you'll see that these go from the active duty members only being able to enroll in prime or prime remote based on their location, all the way down to TRICARE Young Adult for our adult school children, and also TRICARE for Life once we hit the Medicare age. So, we definitely have a program that kind of works for everyone's lifestyle, just depending upon your eligibility based on whether or not you are the spouse or the active service member.
Mm-hmm.
The next slide, please. Thank you. TRICARE Prime. Everyone has their feelings about TRICARE Prime, but it is our baby. It is the cheapest plan to have, especially if you are a retiree. For active duty spouses, and I'm sorry, Sarah, I wasn't privy to whether or not everyone is actually an active spouse or a mix or retired.
It could be a mix, only because it was put out on the main page, so it could be a mix. Yes.
Okay, thank you. I just want to know to tailor my information to include everyone. Thank you for that. So TRICARE Prime is something that is the cheapest plan if we have any retiree spouses in the mix here. In order for you to participate in the Prime plan, you have to live in a Prime service area. You may hear me say PSA because that is what that stands for, Prime Service Area. As an active duty service member, you don't have to enroll in this plan. It's automatically given to you because they don't really have a choice. They're either going to be prime or prime remote. But for you guys as the family members, you would have to enroll in this plan and any of the others that we will address later during the briefing. So you definitely would have to make a decision on which plan you would like to enroll yourselves in. And the great thing about this particular plan is that everything that you get is pretty much base centric. Everything that you're getting done. Your primary care services are going to be provided on base. Your specialty services are going to be provided on base as much as possible, at least. And you're going to see very, very few civilian network providers unless you have, some type of situation where the base can't meet your standard of care within a specific time frame. Otherwise, everything that you get done is going to be pretty much done on a military base or clinic. Can you advance for me, please?
Mm-hmm.
Thank you. So the main gist of this plan is kind of like an HMO. And that's how I like to refer to this as our HMO-based plan, where all of your care pretty much revolves around your primary care manager or your PCM. Getting to know your PCM under Prime is critical. That is the number one person that you're going to go to in order not only to take care of your routine care, but to also address your specialty needs. The PCM is responsible for putting in referrals in the system for you in order for you to be able to access care with specialty providers. So it's very, very important that you remember, if you elect to enroll yourself in a Prime plan, you're going to get most of your care on a base. You're going to have a PCM who's going to be pretty much in charge of your care, and they're going to be responsible for entering referrals for you. If you are a retiree, this will be your cheapest plan for you to purchase. Next slide, please. Tricare Prime Remote. Now, this is something that is only offered to our active duty service members and their active family members. So the gist of this plan is that you're still going to have a Prime or a PCM, I'm sorry, you're still going to have a PCM, you're still going to need referrals entered into the system, but because you are considered remote based on your location, meaning you are too far to access any type of military base or installation, you're going to have to utilize the civilian network. So remember, we have two different networks. We have the civilian side and we have the military side. So if you are considered remote, you're going to be utilizing the civilian side because you are too far from a military base. So that means you still get a PCM from Humana Military or from HealthNet Federal Services. You still need referrals entered into the system for care. And you're just going to be utilizing that particular, whichever contractor you're under, you're going to be utilizing their civilian network. But it's literally the same program and the same rules apply. The real gist is that they don't want you going more than an hour away trying to get to your primary care manager or for any type of routine care. So the rule is you can't be more than an hour away drive time. And we do have a drive time waiver, but anything that I guess either contractor deems excessive, they can deny it and say that, as a family member, you don't fall under remote. So that's something for you to bear in mind, because there are some people who kind of straddle the fence a little bit, who are technically considered remote, but they don't mind doing the drive time waiver. So that might be something for you to consider. The next slide, please. So U.S. Family Health Plan is considered a prime option. Now you have to be in either of the 6 regions that are highlighted in the light blue. Now, I am in the Washington, D.C. area, or the National Capital Region. So our highlighted blue area is affectionately called Johns Hopkins. Now, don't think you have to go all the way to Baltimore if you are within that area, because you don't. We have about 31,000 providers in our community-based plan. And again, each of these slides will tell you that you must enroll. And I'll go back to the point that unless you're the active duty service member, every family member actually has to enroll in a TRICARE plan. Nothing is actually given to you as default coverage. So that's something just to bear in mind as we move throughout the different programs. But U.S. Family Health Plan is offered in those 6 regions. You have to enroll through the actual individual carrier. So because Humana Military doesn't actually administer the plan, you won't actually sign up with this program through Humana. So if you are interested in, for example, our area here in Washington, D.C., then you would enroll directly with the Johns Hopkins program. We do have contact information for U.S. Family Health Plan that will be given at the end of the presentation, and that is how you can, figure out whether or not you fall within the confines of one of the 6 highlighted areas. Now, people really love this plan. I'm sorry?
I said awesome.
Okay. People really love this plan because it's kind of like the best of both worlds. Now, we used to have a plan called Standard, and that was kind of like our PPO version, and I'm going to touch on that next because it's been renamed a bit. But I like to consider this the best of both worlds because it's still basically an HMO-based plan because you still have a PCM. However, you're going to be seeing network providers. The big thing about this program is that you're going to be using that particular network provider. So you will not come into the base for anything. You will not even come into the base to get your scripts filled under this plan. So once you sign up and you enroll in any one of the 6 plans, then you're going to be agreeing to basically give all of your TRICARE rights over to that particular network's providers. So that means you're going to use their hospitals, their urgent care facilities, their pharmacies, their specialists, and their primary care doctors. So that's really what this plan is all about. Now, under Prime, something that I didn't touch on is that we have a right of first refusal, and we have an access to care standard. And these are the 2 things that we kind of circumvent when you go with U.S. Family Health Plan. So right of first refusal, that means if you get a referral put into the system for any type of specialty service, the base that you are enrolled in has 28 days, which is the access of care standard, to fulfill your specialty needs. And if they can do so within that 28-day period, they have the right to keep you. That means if you feel like, oh, I have a dermatology need and the clinic says they can't see me until day 23 from now, if that is the closest appointment that they have, technically the base has every right to keep you because it falls under their 28-day access to care standard with Prime. That's kind of what you're agreeing to when you sign up for the Prime plan. That's a part of coming to the military base. But if you go with U.S. Family Health Plan, you completely circumvent that. And that means most of the times you get into those specialty providers a lot faster because you're utilizing an entire network of community-based providers. So each plan has its pros and cons, and I think it's just really good for everyone to kind of just get at least a general understanding of each plan so you can kind of pick and choose what fits best for your lifestyle. Sarah, next slide, please.
Yeah.
So Tricare Select used to be called Tricare Standard, like I mentioned a moment ago, and this used to be the default plan if you did not sign up for Prime. A lot of our retiree families especially think that this is their fallback plan. And as of January 1, 2018, lots of things changed, and this was definitely one of the programs that changed not only in name, but also in the fact that it is no longer a default option. It is also something that you must enroll in. So again, I like to call this our PPO plan because with this, you see typical PPO associated costs like deductibles, co-payments in the office, and even co-insurances when you're going to out-of-network providers. So with Tricare Select, you have an in-network provider base and an out-of-network provider base. So once you sign up for this program, you don't have to worry about PCMs, you don't have to worry about referrals, but you do have to worry about making sure you stay in network. Now this is where I like to plug humanamilitary.com because it's very, very useful because of its provider resource tool. So essentially, our Select members utilize that Find a Provider tool in order to see who their network providers are. So you're essentially able to take a look at all the specialty providers that are out there, even the pharmacies, urgent care facilities, civilian participating hospitals, so that you will see who is in network and who is not in network. So that's why humanamilitary.com is very, very useful. I would suggest that everyone should probably just go out there and at least take a look at the site, sign up. It's very, very easy to do. Just fill out a profile. It will give you benefit-specific information that is tailored to the plan that you are enrolled in. So if you are especially a Tricare Select member, it's definitely something that I implore that you go ahead and take a look at. So again, Tricare Select, you'll see basically PPO associated costs. It's completely different from Prime because there's no middleman. There's no PCM to put in referrals for you. The responsibility is all on you to go online and see who's in network and find your care that way. Okay, the next slide, please. Tricare Young Adult is one of our really, really useful plans, but there's a lot that I want to tell you about this plan, just to hopefully make using it a lot easier. With Tricare Young Adult, basically your adult children will max out of their Tricare eligibility at the age of 21 or the age of 23 if they're enrolled in school. Now, if they're enrolled in school, this is where it gets a little tricky. I tell everyone who has a Tricare Young Adult dependent, please make sure you talk to your child's school's registrar's office and make sure that you get proof of enrollment. I would even suggest maybe something with an anticipated graduation date so that maybe you don't have to do it every single year that your child is enrolled in the young adult program. It's very, very important that you have that so that you have no lapse in coverage at all. But this is a premium-based plan, and depending upon where your student is located, they could actually be a Prime or a Select member. The Prime Premium is a little bit more expensive than the Select Premium. I think it's $300 and something. I'm sorry, I don't know the premium off the top of my head, but the Select one is about $200 and something, and that is monthly. And yes, it's a little bit costly, but it's way cheaper than the the insurance that's actually offered through the universities. So if you're looking at that and your student is beyond the age of 23 and enrolled in school, then this is definitely a program for you to take advantage of, as they get to keep this coverage all the way up until the age of 26. But they can't be married. They can't have employer-based offered health insurance. And, you know, basically you just want to make sure that you guys show proof that the child is enrolled in school. The next slide, please. Tricare for Life is another big program that I get lots and lots of questions about, and I don't want anyone to be intimidated by this program. It's actually a wonderful thing. Once you reach this Medicare eligible age, you'll get tons of marketing sent to you to buy into supplemental plans. You will not have to do that. Once your service member or your spouse retires, even if it's a medical retirement, once you reach this Medicare eligible age and you have both Parts A and Parts B, Part B is something that you have to purchase through Medicare. It's income based, but once you're paying that premium to Medicare, Tricare for Life is automatically given to you. You do not have to enroll. This is the one plan that you do not have to enroll in. It's something that is automatically given to you once you've satisfied those two conditions, having Medicare Part A and Part B. And of course, you are, 65 or above. And if you're under 65 and you're receiving Medicare, it's due to some sort of condition. So this, again, Medicare pays at 80%. So this is set in place for you to help pick up that 20% coinsurance. So ideally, you're not spending anything out of pocket. Now, again, as you get to that Medicare golden age, you're going to get tons of information sent towards you about buying into the different insurance carriers. You will not need to do that. Unless you know you have some specific condition and you feel that perhaps having the two insurances would somehow be inadequate, then it would be up to you at that point to purchase additional coverage. But having Medicare and having Tricare for Life, for most people, is more than sufficient. Sarah, please, next slide. Tricare Reserve and Tricare Reserve Select, Retired Reserve, is set in place for our reservists and our National Guard members and our retired reservists. And just to let you know, guys, seriously, it's just like regular Tricare Select. It's just put in place for our reservists when they are not being called to duty. They have a Tricare option where they get to hang on, because once they are called to duty, then they're just considered active duty. This is for when they are inactive. And the only group that this would not apply to would be those who are actually reservists who also are federal government workers. So if you are a federal employee and you are a reservist, you would not be able to buy into the Tricare Reserve program. Sarah, next slide, please. These are the 4 different options that you can use to fill your prescriptions. So I'll start this off by saying that if you are enrolled in U.S. Family Health Plan, that is the one condition in which you would not be able to use these 4 options. If you sign up with U.S. Family Health Plan, you agree to use all of their network providers, including their pharmacies. So this slide would not apply to you if you decide to enroll in that plan. But for every other option, even if you are retired, these are the 4 ways that you would receive your medications. So you can come into the military hospital or clinic and use the military clinic's pharmacy. Most people decide to do this because it's probably the most convenient way for them to do so, especially if they are Prime members. And then we have the pharmacy home delivery program, which lots of people love. It's administered through Express Scripts. So that's how you would sign up for the home delivery program if you're interested in it. Even if you report to the pharmacy, I'm sure they have tons of information about signing up for this program. It's pretty awesome because instead of going into the pharmacy or having to worry about picking up the scripts, they're just delivered to you, especially if you take daily maintenance medications. And yes, there are copays associated, because that's a question that's asked a lot. There are definitely copays associated, but it's not necessarily based on the service or having it delivered to you. It's really based on the formulation of the drug. And then we have the two network pharmacies, in-network and out-of-network. I tell everyone to stay away from out-of-network pharmacies as much as possible. There's literally no reason really for you to go to a non-network pharmacy, because if you're using a tool like the Humana Military's Find a Provider tool, if you need to see a network pharmacy provider in your area and you're not sure which one is in or out of network, that's a great resource tool for you to default to. Or you can even call and double check and make sure that someone is in network before you go non-network. Because if you do, you're going to be expected to pay for the full cost of your prescription upfront. And then you're going to have to file your own claim for reimbursement. And when you do, you'll only get back a portion. So I tell everyone to just try to get familiar with who is in network and who is out of network so that you can avoid those higher out-of-pocket charges. Oh, and you know what? One more thing, Sarah, before we advance. CVS is not in the network. As of January 1, 2018, they are not in the network. That means if you're going to Target pharmacies are actually CVS pharmacies. Please do not go to them. Walgreens is the major chain retailer, and Rite Aid. And depending upon where you guys are located, a lot of your grocery store pharmacies might even be participating because, again, in our Washington, D.C. area, our Giant, Safeway, Harris Teeter, those are all grocery store chains, and they are all participating in Tricare Network. And I'm sorry, Sarah, I saw another question pop up.
How can you use the in-network pharmacy when using Tricare Select? This spouse uses civilian doctors and didn't know that it was an option.
Oh, okay. Well, yes, just like I said, you would go online to humanamilitary.com and use the Find a Provider resource tool. When you click on that, you'll have a drop down for all types of specialty providers. And you'll see that pharmacy is even one that you can select. And then you'll just put in your zip code and it will populate all of the participating network pharmacies in your area. And you know what? That kind of gives me a segue to talk about urgent care too. As of January 1, 2018, every beneficiary except for the active duty service members are able to go to any in-network participating urgent care facility for an unlimited amount of visits without a PCM referral. Now, there was a cap. I don't know if it was 2 or 3 before Humana took over. I think it was about 2 or 3 with the last contractor. But when we came on, they did away with that altogether. They want to make, getting access to care a lot easier for you, not having you drive to a military base if that is, where you're prime, if that's not necessarily the easiest thing for you to always do. If you have something that's urgent but not emergent, now you have an option. And you don't have to worry about the billing portion on the back end, having to make sure that there's a referral in the system. They did away with that completely. So I like to tell people to just kind of get yourself familiar with those network providers that are in your community in case you need them, before you need them. It's really good because I don't know about you guys, but I have probably maybe 8 urgent care providers in my community, and I would need to know which are participating and which to stay away from completely in case I actually need them. So using that Find a Provider tool is really great for that. It's also great if you're traveling. If for whatever reason, maybe you might not be near a military base and you have a situation and you got a script put in for you and you want to pick it up and you want to know where to go. Well, check out that provider tool, enter in your zip code of wherever it is that you might be at that particular point in time, if it's not your home, and you can have your provider send your script there for you. So yes, that is an option, and that's how you find out who is in network. Now, the other thing I will tell everyone, full disclosure, everything isn't completely perfect, right? So sometimes someone will show us participating and might not be participating. So I always encourage people to ask, hey, you guys are showing up on my network as a participating provider. I just want to make sure that you do accept TRICARE, correct? And that's just the way to kind of stay on top of things. It is up to those different providers to let us know when they come in and out of network, because some people do that, unfortunately, for different reasons, I'm sure. Going back to dollar amounts on their end, I'm sure that that's really the reason why they do that, going in and out. But they should keep that information up to date because it's up to them to do so. But sometimes you'll find, there's one that may have slipped through the cracks. That's why it doesn't hurt just to make sure that you call and verify before you do anything. And that's just with any service, to be completely honest with you. May I have the next slide, please, Sarah? Mm-hmm. So the Tricare Dental Program, I'll talk about the retirees in just a moment. For active duty service members, they are able to go into the military clinics, but for all of the other family members and other eligible beneficiaries, you would have to sign up for the active duty dental program. And that is actually currently administered through United Concordia, and I think their contact information is also listed at the end of our presentation. But this is something that you're going to have to buy into. It is premium based. So as far as I know, that the monthly premiums are pretty reasonable for their dental coverage. But for the retirees, the program went through a huge overhaul last year. So basically, instead of this TRICARE Retiree Dental Program that you see on bullet number 4 is TRDP, that has been completely changed. It is now called the FED-VIP plan. That's FED as in David, VIP. So it's basically the same coverage that is offered to our civilian government workers. So depending upon where you're located, you will have access to either 10 dental carriers or 6 vision carriers. And I'll just be honest, when I went into that system to take a look to see what the options are looking like for retirees and their family members, I'll be honest, there are tons of options because each carrier has 2 plans for both dental and for vision. There's a high plan and a standard plan. And I will just tell all retirees and their family members to take time when you go on the FedVip site and really sit down and browse the plans. There's a compare and contrast tool on there. I definitely encourage that you use that for either dental or vision. And just give yourself time to really read through the fine print because each plan might have a really attractive monthly premium, but then when you go and look at those benefits, when it's time to maybe get an oral surgery or an extraction or something done, you'll see that they're very, very high co-insurances for those low monthly premium plans. So that's just a little tip when you're on the site to really make sure that you're going through and you're reading the details so that you know what you're buying into. Now, for active duty service members and their family members, vision is being included for the first time ever, and that was implemented last year. And I mean, I honestly still walk into people who have no clue that they are able to buy into this vision coverage. I don't know, if the word wasn't really spread as best as possible, but I really like to get that out there because some people complain about the medical coverage, saying that the vision isn't as extensive as they would like it to be. But now, just in case if you were not aware, please be advised that you are able to buy additional vision coverage even as an active family. It's not just for retirees, for the FedVip plans. And again, you're able to go out there. It's optional. It doesn't change the benefits that you have in place already. It's just an opportunity for you to buy into something that you would feel is supplemental if you need it. Okay? Sarah, could you please advance for me? Mm-hmm. And again, thank you. So these are some ways that you can manage your TRICARE benefits. Now, I'm going to use this as an opportunity to talk about open season, okay? So you're going to get tons of information on these websites that are listed, and I definitely want to throw in humanamilitary.com, okay, because you get a lot of information out there. Tricare.mil is where you can even find my briefing that I'm presenting right now. Like, this stuff is completely out there for the public, for everyone to see. We want you to have access to this information. We want you to be able to go back and refer to a different slide about what coverage means for prime members or what it means for a select member. So this information is out there, full disclosure, on tricare.mil and also on humanamilitary.com. You would use the beneficiary web enrollment website for times like open season. So for the first time ever last year, we implemented an open season. And for the civilian world, this is nothing new at all. Everyone knows that you have an opportunity to browse the plans that are offered to you, and then you make your selection, and then it goes into effect after the open season is over. Well, for the first time last year, they implemented that with the military health system. And essentially, except for the active duty service members, because mind you, they don't have a choice, right? They're either prime or prime remote. But for all the other beneficiaries, you have an opportunity to decide what plan you want to be in for the next calendar year. And I don't know if I mentioned that or not already, our benefits do not run a fiscal year anymore. They run a calendar year. So from January 1 to December 1, that is your benefit year. So last year, the open season ran from November 12th to December 10th. And I mean, it really went until the end of the year, just to give everyone a grace period and to get adapted to it. But it gave you an opportunity to look at the different plans. For example, if you were a Prime member for 5 years and you really just want to try something different, it gave you the opportunity to look at those different plans, select what you'd like to enroll yourself in, and that coverage would start January 1 of the following benefit year. But what that means is you're locked into that plan for the entire benefit year. And that's something that's new. You used to be able to bounce from plan to plan. People would try one and come back to another as much as they like, really, throughout the benefit year without anyone intervening at all. But now that has been restricted completely. So whatever it is that you choose to enroll yourself in, you're stuck in for the entire calendar year, unless you have a qualifying life event. And you'll see that listed probably on the website as QLEs. And that includes things that are considered, major life-changing events like birth, adoption, marriage, death, divorce, relocation even. So those are some of the things that would allow you to change your TRICARE plan in the middle of the benefit year or whenever, as long as it's outside of the open season time. And that not only allows the person who is affected by the QLE to change, but everyone in the family would have an opportunity. As long as someone in the family has a QLE, everyone would have 90 days from that QLE to make a change in their plan if they would like to do so. So that's something major that went into effect last year. I anticipate that the same thing will happen this year around the same time, right before the holidays, I assume. And I really think that by the time that the fall hits, they'll start to send out the marketing, letting everyone know, hey, this is what's coming up. This is going to be the window for you to make those selections. Just please don't toss that stuff when you see it come in the mail, because I know that a lot of people do that, and then they say, well, I didn't know what's an open season. So that's what it's all about. It's about selecting your benefits that will go into effect the next benefit year, and you will be locked into those plans that you select. So that is very, very important. If you would like to do so, you can go online to the beneficiary web enrollment site, and you can make those changes there during that open season time. Or you can definitely feel free to call the 1-800 number. Call Humana if you are under our umbrella, and we can definitely take care of your enrollment options for you. And if you're in the Western region, then of course you would be contacting HealthNet Federal Services, and they would be able to take care of you during that particular time. But please make sure that you keep in mind of these different websites, because a lot of people really expect for things to be kind of spoon-fed to them, and it doesn't always go that way. And sometimes people miss really, really important information. So if you can please just kind of make a note of these websites. And I really want to give you one for FedVips too. It's called benefeds.com. That's www.B as in boy, E as in Edward, N as in Nicole, E as in Edward, F as in Frank, E as in Edward, D as in David, S as in Sam.com. benefeds.com. That's where you're going to go online and see all of that FedVip information. If you're an active family, then you can see those different options for vision that you can buy into. And if you're a retiree family, then you can see both the dental and the vision coverage that's offered to you on that site as well. Sarah, could you please advance?
Mm-hmm.
Thank you. So this slide basically lets you know that all of our TRICARE programs that we offer more than meet the ACA's essential coverage requirement. And again, it touches on the fact that you have to keep your DEERS information up to date, guys, because the IRS uses the DEERS information to verify that everyone has kept their coverage intact for the entire year. So they send you a 1095 form for your tax filing purposes based on the information that's provided in the DEERS network. So it's very important, again, going back to the beginning of the briefing, to keep your DEERS info current. Sarah, could you please advance? And one more. And this is actually the contact slide I was talking about. This pretty much goes over all of the important things that are listed that you might need to refer back to, except for that retiree dental program that's in the middle column down at the bottom. That one, again, we will not be using anymore. We are now using the FedVIP program with BeneFeds, www.benefeds.com, as the contact for that. So when you go onto BeneFeds, if you are interested, in case anyone was wondering, you do not actually sign up for those benefits through Humana or through HealthNet. You will actually sign up for those benefits through the individual insurance carrier that you decide to enroll in. So if you're looking at a United Healthcare program for dental, then you would be contacting United Healthcare directly. And through the BeneFeds website, it would direct you to that particular carrier that you're interested in once you select it. And this is pretty much a time that I like to open up for questions. If anyone has any, please feel free. I'll do my best.
Got one under the Q&A. I'm going to stop sharing, everyone. It's just going to be a little bit easier for me.
Okay.
So is Echo covered under the insurance, or is it a different program?
Echo is a program that is covered under TRICARE.
Okay. It's a very good question, Tracy. Anyone else have any questions?
I don't know where that young lady is located, but in our area, we have ECHO programs under the EFMP, which is Exceptional Family Member Program. If you are near to a base at all, you could definitely stop by an EFMP office to find out who would be your ECHO point of contact, because pretty much every base has it. If you are not central to a base or you're in one of the other plans, then ECHO is still definitely a covered service under the TRICARE umbrella altogether.
If my child is covered under one service member under East, how does insurance work if he is seen in the West region?
So you'll still, one, I want to say it depends on the plan. If you are a select member, it won't really completely matter too much. They're just going to see the other contractor's provider. Mind you, your benefits don't change based on where you are. If something is a covered service, then it's just a covered service under TRICARE, period. They would just, coordinate benefits with the other plan provider. But if you are a prime member, for example, and that's a really good question, you're going to have to coordinate care with your PCM. That PCM is going to have to authorize you to see another provider, even in another region even. So you definitely want to bear in mind, if you are a prime member, that you are still following the plan rules. The only time that you would get to circumvent that is if you have an emergency. Obviously, if you have an emergency, then you just go to the closest emergency room and then we worry about the bill on the back end. But if it's for something that is considered routine or non-emergent, then you definitely have to still follow the plan rules, have a referral entered into the system. Care would still be authorized for your child to be seen elsewhere in the country.
All right, here's another good one. Is dental coverage stopped at the same age as TRICARE?
Does that mean for the child? Is that what you mean?
I believe that's what she means, yes.
That's a good question. I believe so, because under Tricare Young Adult, dental is not an offered service at all.
Mm-hmm.
Once your child, so I guess that is the max out time. It's probably the same either at 21 or at the age of 23 or graduation date, because under the Tricare Young Adult program, your child will not be able to receive dental benefits. So you would have to purchase individual coverage or civilian coverage that way.
Okay. Okay, here we've got three more. If TRICARE is my secondary insurance, is it best to have Prime or Select? That's a good one.
That is a good one. I think I would say that that's probably up to the individual and up to your preference, whether or not you're close to a base. It won't really completely matter which way you go, because TRICARE is going to pay secondary regardless if there's another insurance payer in the mix. The only time that we would pay primary if there is another health insurance carrier, even if there's another pharmacy carrier. People always forget about pharmacy too, but TRICARE would be secondary if there's another pharmacy carrier as well. The only time that we would be primary is if you've reached the benefit maximum with that primary carrier, or if something is not covered under your primary carrier, but it is a TRICARE covered benefit. So it would really just depend on what's easier for you, whether or not you like coming into the MTF or military treatment facility. I would, I guess, suggest that you do Prime, or whether you feel comfortable with finding your own providers in the system and utilizing the network on your own. Some people like having that independence and that freedom to pick their own provider, whether they're primary or secondary carrier. So I think that really just depends on your ease of use with the system, and not necessarily whether or not because it's primary or secondary, if that makes sense.
Does make sense to me. All right, we got more questions coming in.
Okay.
So if they have been enrolled in Prime over 10 years and their vision has been covered to this point, do they need to enroll in vision through benefits, or does the coverage continue?
Now, their coverage would definitely continue. I want to make sure that we're clear on that. Like, your medical benefits that are offered, they do not change. This is just something that gives you an opportunity to buy into this additional or supplemental coverage. I know I've talked to tons of people on base, because I worked at Walter Reed for 6.5 years in the internal medicine clinic, and then 2.5 years in our ER. And I ran across lots of people who complained about vision coverage, wishing that certain lenses were carried on, and found that certain things were insufficient, especially our retirees, feeling that, oh, they want to be able to come in to get more exams done and that sort of thing. So it would really depend upon whether or not you find it necessary for you to buy into it. If you find it inadequate for any reason, if you're unhappy with the lenses that are offered, if you feel like maybe you don't get a discount for LASIK or something like that, like, it would really depend on your need for additional coverage. If you find that for the past 10 years it's been sufficient, then this might be something that you can just bypass. But there are tons of people who are, a bit unhappy with what is offered, and they are very happy to see that they do have an option to buy into something that would be considered supplemental, but it's completely up to you.
All right, a few more coming in. And I pretty much know the answer to this, but I will let you answer.
Okay.
Is infertility covered?
That is a good question that I do not know the answer to off the top of my head, actually.
Okay. So I can kind of touch base just a little bit on this. It depends on what the infertility is. As far as that, my husband and I were going to have my tubes reversed. As long as it was done, there were some strict guidelines with it, and it was done in a military treatment facility. But like IVF, stuff like that, it's not covered necessarily. So you just need to look into the different, whatever your infertility issues are. And I would get in touch with your PCM, because they'll be able to definitely tell you what is and what isn't covered. Those are my comments.
Thank you, Sarah. Thank you for that.
You're welcome. So are there any good supplemental programs for copays?
I'm sorry.
Supplemental programs for copays. So if they have copays, are there any good supplemental programs that they could add on to help alleviate that?
Not that I know of. So the only plan that you would see copays in are the U.S. Family Health Plan option, and also with Tricare Select. And as far as I know, if you are signing up for that, there's no way of getting around those copay amounts. I'm sorry. I've never been asked that before, but no, not to my knowledge. There are no supplemental programs or anything to offset the cost of the copays or any of the out-of-pockets that are associated with TRICARE costs, including deductibles, co-payments, co-insurances when they are applicable. No, ma'am. I'm sorry.
Yep. All right, so 2 more as of right now. We'll see what else comes in.
Okay.
So when receiving an explanation of benefits sheet from a doctor's appointment and a code says it was incorrect, so TRICARE denied it, is it their responsibility to get it fixed?
As the patient?
Yes, versus the doctor getting it fixed, I believe.
Now, speaking from a consumer's point of view,
Mm-hmm.
I always encourage people to be proactive. Like our 1-800 number, when I tell people to call a 1-800 number, they kind of cringe. And I understand that a lot of people don't like doing that, but a lot of those people are very knowledgeable, and they can direct you to the appropriate claims person that would be able to assist you and could give you suggestions on what to do in order to handle a claims issue if you receive a denial. To be completely honest and forthright, when we have issues that are brought to us as individual reps, we call the 1-800 number too if we are unclear on something, because our role doesn't necessarily put us into the enrollment side or into the claims side. Mm-hmm. So we rely on those people to assist us and guiding us to get the beneficiary's issues resolved. So whenever I see someone with a denial, I encourage them to contact the physician's office and let them know that this is why it was denied, and to ask them to please resubmit on their behalf. There is nothing wrong with you asking your provider to resubmit your claim for you in order to get it pushed through and to get it paid. I mean, ultimately, both you and the provider benefit when it's processed properly and paid. So that is definitely something that I recommend that people do once they receive it, not to just sit on it and hope that the provider does it. I would definitely tell people to be proactive because I've definitely been there as well. And I would definitely call the provider and ask them to resubmit after fixing, whatever the coding issue might be, and have them refile, because at the end of the day, they want to get paid too, and you don't want to be stuck with a bill. So it's really important that they take care of that, and don't let them do it just on their own time, because every insurance carrier, including TRICARE, has claim filing limitations. So it's something that they need to stay on top of and do right away.
True. All right, 1 more, and then we will wrap it all up, if that's good with you.
Okay.
Is there a way for a spouse to change plans if the sponsor is deployed, or does the sponsor have to be the one to make the change?
For the spouse to make a change on their plan?
Yeah, can the spouse make a change to the program?
Absolutely.
Yeah.
Absolutely. So because we have this open season that went into effect last year, you would have to have a qualifying life event. I do believe that having someone relocated, which would be a deployment, would qualify as a QLE. Now, mind you, when the QLEs are applied, they are not just applied to the individual that it's happened to, it's to the entire family. And you do have a window. And I'm sorry, you know what? I said 90 days prior. Oh my gosh. I do want to double check and see if it's 45 or 90 days because I for some reason, 45 is sticking out in my head right now.
Mhm.
You definitely do have a window to make those changes, and you can certainly ask, you know, either by calling in the 1-800 number for either of the contractors, depending on which region you're in, and say, hey, I'd like to go ahead and move, over to this plan or that plan. As long as it's something that Humana manages and it's not the U.S. Family Health Plan option, you should be able to do so through Humana Military directly.
Mm-hmm.
So the short answer to that is yes.
Yep. Well, sometimes you got to know all the meat and potatoes in there, right?
Absolutely. I want people to know why. And you know what? One more thing is a qualifying life event. And I just found this out recently too, is that a lot of times bases do a lot of realignment and they change people all the time, and they move people from PCM to PCM without letting them know. And all of a sudden you get a letter in the mail saying you've been reassigned. That is now a qualifying life event, guys, which is awesome, because I've seen this happen so many times to people. They'll be on one provider's team, and then the next thing you know, they've been reassigned. They go to make an appointment with that provider that they have a rapport with, and then all of a sudden they find out they're under someone that's new to them. They're under their panel now. So that's something that you can use as an opportunity as well. If you find that you're unhappy, or you're just not satisfied with the level of care that you're receiving under a particular plan, you can also use that as an opportunity to change your plan if you'd like to.
That is awesome. There's been so much amazing information. I know I have learned a lot after 21 plus years as a military spouse. You learn something new every single day. So thank you to everyone that joined us. Thank you to Shantae. We are going to actually wait and do the drawing in the background because there were so many on. I want to make sure that I get everybody's name in there. So I'm going to look at the roster momentarily and do the two drawings for the two $25 gift cards from Armed Forces Insurance. So be checking your email because they will come via email. And if there are no more questions, we will let you guys get on with your evening. Thank you for joining us. If you were a National Guard or Reserve spouse, we are also going to be having one specifically for you in the next couple weeks. So please be on the lookout on the main MS Military Spouse Advocacy page, or you can also join the forum, join our new spouse forum, because we would love to have you. So thank you again, Shantae, for all of the amazing information tonight. I know that it was a lot to soak in. So thank you again for joining us.
Thank you so much for having me. I hope you found the information to be useful. Thank you.
For sure. All right, everyone. Well, we will let you go for the night. We hit about an hour. That's what I was figuring we'd be at. So have an amazing night, an amazing week, and a very safe and happy 4th of July. And I'm sure that we will be talking to you very soon. Have a good one, guys.
Thank you, Sarah. Bye-bye.
Bye.